Well, it's safe to say one of the most vital times in a child's life is their development inside the womb. That's why when a pregnancy is considered high risk, medical teams stop at nothing to ensure mom and baby are okay. The team at Chesapeake Healthcare is no exception. Delmarva Life Sydney Whitfield stopped by their new facility to learn more.
The Perinatal Center is one of the newest additions to Chesapeake Healthcare, and I'm here with Dr. Michael Lance to tell me more about it. Thank you so much for letting me come out here.
Thank you for having us.
Absolutely. So tell me a little bit about the Perinatal Center.
So the Perinatal Center is a center within Chesapeake Healthcare OBGYN where we manage high-risk pregnancies. So high-risk pregnancies is really defined sort of broadly as any fetal or maternal condition that may complicate the pregnancy or adversely affect pregnancy outcome. So an example, we do probably 30 to 40 diagnostic ultrasounds here daily, would be if we diagnosed a baby with a birth defect. We would be able to help the mother manage that pregnancy and make arrangements for the delivery and things that would improve the outcome. The other fetal condition that would be high risk would be an example would be if we see the baby's not growing normally. Then in our antepartum testing center, we can monitor that pregnancy, make sure it's still healthy for the mother to continue that pregnancy, and then it aids us in timing of delivery. The two biggest maternal conditions that we see in this region that complicate pregnancy is really hypertension and diabetes.
Okay.
So we do a lot of close monitoring of those two conditions during pregnancy. And we really try to optimize blood pressure control and blood glucose control as early as possible. And we know that will improve pregnancy outcome.
And Dr. Lance, you were born in Cambridge, or you're from Cambridge, but then you also were working in Annapolis, and now you're back here.
Right.
Because you saw a need for this kind of service.
Right. So I was born on the Eastern Shore. I've had a 20-year working relationship with the OB providers in this area, both the physicians and nurse midwives, who have done a great job of managing these patients. But there really is no perinatal center in an area bound by Annapolis, Dover, and Norfolk. So we felt that the area was underserved, and having been from the shore, it was kind of a natural fit for me to come back.
So yeah, they would have to go over the bridge to get that care.
Yeah, historically, the patients that would need this specialized care would have to travel, to Annapolis or to another larger area for this specialized care. So we're really happy to be able to bring it to the shore.
Yeah, that's awesome. So the service that you're bringing is a little bit different than what you would be getting if you were going to an imaging center, right?
Right. The practice is very heavy into diagnostic ultrasound. And one of the things that we try to do for our patients, that if the patients come here for their ultrasound, almost all the patients will see the physician. So if there's a concern or a complication, we can give the patients real-time feedback about that. And being trained in obstetrics, we can sort of figure out a management plan almost immediately, so we can implement that, all in an effort to improve pregnancy outcome.
Okay. Well, let's say someone's watching and they are interested in your kind of care. What exactly can they do? Can they go to the website?
They can go to the website. The practice is all referrals from other physicians and providers, midwives, nurse practitioners, etc. So they would just go to the website or call the office.
All right. Well, thank you so much, Dr. Michael Lance. All right. And if you'd like more information on the Perinatal Center, make sure to go to our website, delmarvalife.com.
It's so nice to have that kind of service here on Delmarva, and you can probably tell Dr. Michael Lance is passionate about his work. As he mentioned, he was born in Cambridge, and now he's back to help the people here on Delmarva. Welcome back.